Imagine going into labor and feeling terrified that the government might arrest you. This is the reality for some pregnant immigrants under supervision of the US Immigration Enforcement ICE. A pregnant woman arrived at a US hospital in labor, wearing a mandated GPS smartwatch. When doctors needed to remove the device for a C-section, she panicked, fearing ICE would think that she was trying to disappear. Similar incidents happened with at least 2 other pregnant patients recently. Why should we care? Well, because it's an example of the downsides of government surveillance. How much tracking are we willing to accept, and by who? Pregnant women under ICE supervision must wear GPS-enabled smartwatches under the Alternatives to Detention program. It tracks their every move, even in the hospital. They are not allowed to remove the smartwatch themselves, only an ICE agent can. If a watch is removed, ICE could interpret it as an attempt to evade monitoring, potentially leading to detention or arrest. That's why some pregnant women refuse to take them off, even during medical emergencies, and even when the watch could interfere with medical equipment. The smartwatches used by ICE don't just track someone's location, but also record sensitive medical information. Combined with facial scans, court and personal records, this feeds a massive US master database covering nearly 190,000 immigrants. Experts warn that centralizing data like this creates huge risks, like hacking or abuse. If, for example, insurance companies got access to such a database, they could deny coverage based on health or immigration status. A database like this can put vulnerable groups at serious risk. NGOs say this level of surveillance violates human rights and jeopardizes health access for vulnerable groups like pregnant women and asylum seekers. ICE argues the monitoring methods are a tool for compliance and public safety. They say their goal is to limit immigration and prevent people from crossing the border without visas or proper documentation. They also refer to pregnant and nursing women specifically, saying they will never detain them unless there are exceptional circumstances. They don't give any details on what those may be. So, does public safety justify surveillance methods like ICE's tracking with smartwatches? Have a look at this. Fear of ICE enforcement is driving people away from vital healthcare. In Chicago, one major health center saw a 30% drop in appointments and a 40% drop in prescription pickups since 2024, driven by fear of ICE. Pregnant women who delay or skip medical care risk serious health complications for themselves and their babies. This isn't the first time US authorities have been criticized for their surveillance methods. ICE's mobile license plate app lets officers scan license plates and run facial recognition in real time using a program called Mobile Companion. By tapping into private and commercial camera networks, a powerful nationwide tracking system was created. Constant tracking needs more data and power for authorities. On the other hand, it's invasive and can be a serious violation of personal freedom. How do you feel about surveillance? How much is acceptable and under what conditions? Share your thoughts below.